to navigating the licensure exam. And we're fortunate to have with us Dr. David Hussey, who's on faculty and has done these presentations for many years now, and our student services team to help manage our panelists, Christina Vukovic and Trisha Bravi, an alum and a current student of our program who have both navigated the licensure experience. So you'll get to hear more in a few minutes from Dr. Hussey about the licensure process. Then you'll hear from our student and alum, as well as get a chance to ask your questions and have some interactive Q&A. And I'd like to also welcome our online guests today. We have quite a few people joining us from around the country, so it's great that we can offer this in a hybrid format. So save your questions and your comments, and we'll have plenty of time for those as we move through the session. But I'll turn it over to Kelly Schmidt for a little icebreaker for us.
And just know for everyone online and in person, we do have your questions that you submitted when you registered. So we'll get to some of those, but feel free to also put them in the chat as you go. I know sometimes it's like things come up as we go, so feel free to ask those questions or save them for the end. So we'll open up for that Q&A, but we're gonna get started with a little cute icebreaker. I know it's right before fall break, and depending on your feeling, I thought I'd just do a little grounding icebreaker to get us started. So for people online, if you wanna put how you're feeling today, if you can put the number based on, you know, a scale of puppies and dogs. Because if you don't know by now, I love dogs. So, and in person, we'll just raise our hands if you're okay with it. But in online, if you want to put in the chat the number, how you're feeling of on a scale of dogs 1 to 8. So who's feeling a 1 right now? It's okay. I am, I would say. 1 is pretty good. Or a 2. I think a 2 is pretty good. Okay, 2. How about, I think these next couple might get one. How about a 3? Oh, okay. Just a little sleepy, maybe. A little worried about the next 4. Okay, a little angry, maybe. A little, that's okay. 5. Yay, I like number 5. All right, I know it's lunchtime-ish too, so 6, how are we feeling? Anyone really resonates with 6? Oh, not so playful. That's okay. All right, and then 7, I think also is a good one. How are we feeling with 7? Yeah, 7. And maybe just based on the material of what we're going to cover in this session today, do we have any 8s in the room? All right, that's okay. Well, thanks so much for participating, and definitely maybe we'll check in to see how we feel afterwards. Maybe your numbers will change and how you're feeling. But I'm gonna take it off shared screen right now and give it over to Dr. Hussey to kick us off. Make sure. All right, take it away. Thank you so much.
Right. So this is sort of an unusual part of the social work training. In the life of your career, you potentially have 2 exams. This is one, the LSW and then the LISW. And in many ways, these are artificial experiences. Artificial experiences in the sense that they're the way the field attempts to sort of test competency. But it's not the greatest way to do it. Multiple choice tests, and you know that. So what we attempt to do is we attempt to do the best job we can in helping to prepare you to take those tests, realizing sort of the limitations of what they measure. And probably what I would say, one of the biggest barriers is really anxiety, is basically the anxiousness about taking a performance test when you haven't been used to that for some time. So much of the preparation that you'll receive through, for example, the LEAP course and other things helps you to do that. Part of it is content-based, don't get me wrong, but part of it is also just to get you used to the type of performance testing situation, multiple choice questions, so you feel comfortable and can actually demonstrate what you know. That's the big piece, and that's critical. So if you think about it, there are a couple of different tests through the Association of Social Work Boards. There's a bachelor's, there's the master's, which you're taking, advanced generalist, and the clinical. Again, most of you, I hope, will take 2 tests. This is one. Another one will be for your LISW, which professionally helps to advance you. It gives you more opportunities to do more things such as supervision, program development, those kinds of things. And it typically affords you more money, that you get paid more. There's something you can point to that sort of says I've achieved at a certain level. When you graduate and become a social worker every 2 years, 30 hours of continuing ed, that becomes part of your requirement. And after a while, sometimes you get fairly selective because you want to attend, you want to have the best information that helps you to advance in your career and helps you to do better. And that's a good way to sort of think about it. If you think about the LSW exam, think about it in terms of 3 steps. And this is sometimes where it gets a little bit confusing, but you sort of have 3 entities. You have the counselor and social work board. So that's one entity that you're trying to deal with. Credentialing board, counselor, social worker, marriage and family therapist. And then you're going to look at the social work part within that 3-part sort of board in terms of requirements and things that you need to do. Then you have the Association of Social Work Boards that actually are responsible for the exam. The exam is a national exam. It's the same across all the states. However, some states have different requirements about when you can take the exam, or different requirements about the number of hours of supervision that you may need in order to get your LI or LCSW. So if you plan to relocate to another state, what you want to do is you want to begin looking at that other state and what their requirements are. And it's fairly easy to find. It's fairly easy to find if you know the state. And then the third entity through ASWB is the Pearson VUE portal in terms of actually taking the exam. So that's the third entity. So you have the state credentialing board, you have the board developing the test, and then you actually have the vendor for the test itself. So think about 3 sort of registrations that you need to go through. You will need a letter of good standing, which our registrar provides, so that information is available to you, and we try to make it as easy as possible for you to do that. There are 2 resources I really encourage you to look at. The ASWB website has an exam candidate handbook. Exam candidate handbook. A lot of very good practical information. There's also at the state credentialing social work website, laws and rules. There's a video about 38 minutes and a PDF. It's worth your time to look at that and to go through that. It supplies some very practical, important information. Some of it will actually be more helpful when you take your LISW exam. But I think it's a good idea to look at that. It's divided into 2 parts. Information related to the Ohio Revised Code and some of the laws and rules that govern us. And then the other part is the Ohio Administrative Code. Those are the 2 entities of law, administrative law, Ohio law that will govern your practice and govern what you do. So it won't take that long to look at that video or to read the sort of PDF. But I think what they do is they both will give you some more confidence about the process and about some pragmatic details. So it'll include information about scope of practice, competency, training, supervision, those kinds of things. The test itself is about 170 questions, 150 are scored, 20 are experimental. They have test questions where they're trying to see how good the questions are. You know, if you put a question on a test and 60–70% of your students get it wrong, you might want to reconsider your question. It may be the wrong question. And it might not be the student knowledge and content. They're divided into general categories. Categories are human development, diversity, and behavior in the social environment, assessment, intervention planning, interventions with clients and client systems, professional relationships, values and ethics, and those experimental questions that I mentioned. The general guide is plan early. You have busy schedules. You know, when you get to your last year in particular, you're thinking, you know, about what do I need to do to complete my courses, complete my requirements here, but you're also thinking about the jobs, thinking about your careers and field. So you will need to set aside time. There's an abundance of resources that are available, LEAP being one. I identified two other ones. But basically identify what resources you're going to use. One of the things that is the most helpful is to take practice tests. Take practice tests. And part of the nice part about the practice tests is if you get the answer right or wrong, you get the rationale. And the rationale gives you an idea about what the test makers are looking for as they construct questions. What's the rationale? So I'll give you an example. I'll give you some examples. One of the things you'll see is that generally safety trumps almost everything else. Generally safety trumps almost anything else. Where it gets foggy is if autonomy comes into play and the safety issues aren't of such a degree or severity that they actually might harm the client or others. But generally, safety trumps everything else. Secondly, questions we'll ask, what do you do first? What do you do last? Those are important things you'll learn about later. But generally, what do we do first? We engage and assess. So you don't plan, you don't treat, you don't do interventions until you engage and until you assess. So these are all things you're familiar with, they're things you've learned, but they're really important because it'll ask you, you know, what to do first. And you'll see the right answer about what to do, but it may be the thing you do second after you've assessed, established that that's a problem or that truly is an issue. So think about your sequence, about the things that you do. The exam is big, typically on, and this is probably even true for LISW, you don't engage in multiple relationships. Multiple relationships typically cause conflicts of interest. So watch for that, because there's other things you may do as a therapist to help your client. Good things, but they might put you into that category of having a dual or multiple relationship with the client that generally is something that you want to avoid. And again, a lot of this will come up in LEAP, a lot of this will come up in your preparation, and a lot of it will come up in your test questions. You'll see the rationale about these things, about what to do, about what not to do. When you schedule a time for the test, you'll need to bring 2 photo IDs, primary one, photo, secondary one. I think you also have a palm scan taken in a photo. Then it's a test. There are security issues. Leave your stuff in the car. It's a test. You'll have a locker. You have 4 hours. You might not need the 4 hours, but you have 4 hours that includes your breaks, unless you have special accommodations. So think about it in those terms. You do get the results when you take the test, just pass and fail. It's not till later that you actually get more refined results, you know, about questions and things like that, but you'll get your results pretty immediate. If you don't pass the test the first time, you have a 90-day period, you can take the test again. And you'll know what areas you need to brush up, what areas you were stronger in, what areas you were weaker in. So that'll help you significantly if that happens again. So I'm going to stop there. Those are my sort of introductory comments.
Thanks so much. So we'll bring our panelists, and again, keep your questions, and we'll open it up at the end. So I'll hand it over to Sharice.
I want to introduce Christina Vukovic and Trisha Bravi. Thank you both for agreeing to be a part of the panel today. And then if you want to do like a self-introduction so everyone knows who you are.
Trisha, you can go first. Oh, I said it quietly. So my name is Trisha Bravi. I am a current student in my last semester. I've been doing the dual MNO and MSW with a trauma-informed certificate. And I took the exam in October and passed it, so very exciting. And I'll have my degree in January, so it should be active then.
Awesome. Yeah, so I'm Christina Vukovic, and I actually just graduated in May, and I currently work as a research associate at the National Initiatives on Mixed Income Communities, actually at Mandel on the second floor. And I have my MSW and MNO, and I'm actually currently studying for the exam. I decided to wait because I was a little more concerned with getting a job first and wanted to kind of take time, make sure that I could study afterwards. So I'll be taking the exam at late January. So yeah, there we go.
Yeah, thank you both. So we're going to start with some prompted questions, and both panelists will share their experience. So the first question is, and whoever decides to go first, what do you feel the most helpful to individuals when studying and applying for their licensure?
So Dr. Hussey already touched on this. For me, the most helpful thing for studying was taking practice exams. I think I took 3 or 4. And I also found it really helpful to study with someone else. Knowing myself, I would have like waited until later than I should have in terms of studying and making sure I was prepared. So it was really helpful to study with someone else, just for like my own accountability, but it was also really helpful to like see what both of us may have like missed, like where like hearing each other's rationales for why we answered certain things some ways, especially if one person got it right and the other person got it wrong, because we were typically taking the same practice tests. And really focusing in on like areas of like practice, like the LEAP handbook or other like preparation books that like aren't necessarily covered in like they weren't covered in my experience at Mandel. So really focusing in on like where my gaps were and identifying those was really helpful.
So same thing, I think Dr. Hussey and Trisha covered most of it. In terms of applying, I would say 2 things that really helped me was actually calling the board. I'm a big talker, so like I need someone to process with me. And so they were quite helpful when I had questions, and also just talking to other friends when applying. I definitely leaned on my friends to figure some things out. So they were extremely helpful in that process. When it comes to studying, as I'm also still studying, I would say come up with like a realistic plan. That's something that was some trial and error for me, where I was like, okay, I'm going to study like 5 days a week for 30 minutes. That was not the case. I definitely needed to check myself and be like, hey, like you really can only dedicate 4 or 3 days a week with everything going on. And also that telling myself with studying, it's also okay to reschedule your exam. That is something you can do. I actually have rescheduled it, I think, twice, because I ended up having either certain life events come up that I was like, I just can't dedicate time to this, or I was just like, I don't feel ready to take this exam yet. And so I did push my exam date back further, which I think ultimately is helping me in just, again, taking the pressure off and the anxiety off of the studying portion and making me feel a lot more prepared. And these you'll kind of find actually in your LEAP book. So I do really recommend reading the intro to the LEAP book. Don't just skip over it. It did really help me with learning like, hey, maybe I should, when I'm looking at questions, read the question thoroughly, but come up with the answer first in your head before actually looking at the answers. So then it can decrease the second guessing that you'll have, because you're gonna try and then match your answer to what answers that they're giving you. So if you can think of the answer first and then try and match it to what you are thinking, that's gonna be a lot more helpful. You'll feel a lot more confident, solidified. And then I think like the other last portion is just what Trisha kind of had mentioned, was like using the practice exams as like identifying areas for further improvement in studying. Don't memorize the questions because they are going to be different. And also mimic the environment that you're going to be in. So like when I take the practice exams, I try to make sure that I am like trying to siphon off, if you can, maybe not full 4 hours of your day, because that's a lot to try and, pack into your life. But like, make sure you're gonna be in a quiet space or like in an area where you know that you can kind of try and mimic that same environment to reduce that test anxiety if you have it.
Alrighty, thank you. The next question, what do you wish you had known before applying for your licensure?
I wish I would have known how expensive it was. It's really expensive. So that was something I had to factor in a little bit, and save a little for, just to make sure I put some money aside. Sorry, I have to look at my notes. It helps me, remember what I actually want to say. Just also like the cost of the CEUs as well. And something like when I was looking at in terms of job hunting is actually looking for a job that's going to help me cover professional development costs. So then you don't have to bear that up front, because again, that's also kind of a lot of money to keep continuing those education, getting those CEUs. And then I think like really the necessity of the exam too, really weighing in on if this is something that's necessary for you. I was a community practice concentration, so I went into macro, and a lot of my people in my cohort didn't take the exam, and I decided to take it primarily for the reasons of one, like I think it's going to just help me learn and grow, and I still want to keep that connection to direct practices. I feel like it's really important to stay connected to the communities that you're going to ultimately be serving. But then also, just to be real, like you get more money, like you are going to get more money, and cost of living is expensive. So like, it is just something that you have to keep in mind.
Yeah, I think like for me, like what I wish I would have known, like someone did kind of help me through it with it, was like all the steps that Dr. Hussey was talking about. Like everyone, like when my cohort was all taking it like last May for the most part, like people were talking about how long it would take and like making sure you like start that process early, and it is important, but it also went a little bit faster than I anticipated it going. But also like you have to stay on top of it. So it's like once you get the letter of recommendation, you can apply for the license. You can also like start the application before getting the stuff from the school. But then like once it's approved, then you have to like do the next step of like paying for it and scheduling it. And it's just like you get emails. So like for me, it was like as soon as I got the email, I was scheduling it. Like I was doing the next step because I know that I would have gotten like distracted and I didn't want to make it last any longer than it needed to at least get it set up and get it scheduled. So really like making sure you know what those steps are ahead of time, I think is really helpful.
And then the next question is, what lessons did you learn throughout the process? Yes, you can say.
So for me, like I have ADHD, and I've been told plenty of times to study certain ways, and it's like for me that it doesn't always work how other people tell me to study or advise studying. So Christina said it, like make a plan that works for you in terms of like fitting it in, but also make a plan for studying that is realistic for you. I didn't read through any prep book all the way through. The LEAP book says to read it 3 times through, and if that works for you, then absolutely do that. I know people who did that and that worked for them. I would have never been able to do that realistically. It's just like would not have happened. So I know that for me, like doing the practice test was like how I started really, because then I could identify gaps, identify things that I was like weaker on, and I could focus more on that. And that felt a lot more manageable for me. Like I also joke that test anxiety is the one anxiety I don't have, so like I have to like also take that into account that like for me, like I knew I would never feel totally prepared, but feeling prepared enough felt good enough for me, especially when I was like doing well enough on the practice exams to feel comfortable. So it's like really figuring out like what that point is for you and like just really making it as individualized as possible, because I think that's going to be the best like result for each person.
Yeah, and I mean, hey, you're a testament to passing the exam, so you did it, you know, you did do it. So, I'll be modeling that for myself. But yeah, I think some lessons that I learned is I'm just still learning as per usual. Like I'm looking at this and I'm like, oh wow, there's a lot of stuff that I missed in school. Because you're learning so many things and everything's going so fast paced and you're just like, okay, just trying to cram all this info. And as you're, you know, looking at this stuff, you're like, oh, this is a refresher, this is a reminder. So just keep it up in mind that you're still going to be learning. Or for some of you, maybe it's going to be a review and that's awesome because you're just able to retain a lot more information, you know? But I think like also just something I learned too is it does look different, like taking the exam after graduating and while you're graduating, because you're busy in both aspects of life, but possibly for different reasons. And so just like discovering how you really just have different like studying habits during school, because you're supposed to be like studying and learning, but then after school, you don't have that set time anymore that you're doing that. So you just figure out like, hey, like, when am I going to do this? How do I keep myself motivated to do this? I think really just this whole process is teaching me like more self-awareness and that reflection of how you actually function in different parts of your life and different transitions in your life.
Thank you. At this time, we're going to open it up for questions in person and online. Kelly is going to monitor the chat. So do anyone have any questions?
How important is the score versus pass fail, and like how is the score, I don't know, viewed after you've taken the exam? Anybody looking at it?
I don't think
No.
anyone would know your actual score on the exam. I think like they would only know pass fail. Like I will amend something Dr. Hussey said. I found out how many questions I got right when I took it. Like that was in the result. Then not, I don't know which ones I got wrong, but I think it just matters for the pass fail, and I might be wrong, but I don't think that anyone else would know whether or not like if you got just as many questions as you needed right, or if you got, you know, 20 extra questions right.
To my understanding, they don't care. Nobody cares. You just get the pass fail.
Yeah.
And you get the licensure, you know, it's not like law school, you know, thankfully. So, that's my understanding, but I don't know if that is true or not.
I think that's very true. And if somebody asks you, what was your score on your master's license exam? Make sure you have other interview options.
Or you can ask them what their score was.
I know Sharice had worked, this is funny, it reminds me, Sharice had worked in an HR department and she would have to look up people's licenses.
Yeah, I
Yeah.
would, and we would have to verify
Yeah.
that the license was still good. Yeah.
But it just says pass, like. that's
Yeah,
all
like
it says.
Like if your license is active or not.
Yeah,
which is, like,
exactly.
all intact. I will say for me, it was like a point of pride seeing how many questions I got right, but it was just like knowing like that wasn't like where I was in terms of taking.
And what's the threshold?
So it depends. Each test will vary. The ranges I've typically seen for questions you need right vary from about like 90 questions to 107.
I just looked it up before, that's right.
I looked up a couple months ago, so I remember numbers really well.
Well done.
On my test that I took, I needed 99 correct. So like the test that you take, it'll tell you how many you needed to get correct, and it'll also tell you how many you did get correct. But it really depends on like the specific questions that they include in your version of the exam, since they have a whole bank and not everyone's taking the same 170 questions.
Yeah, we did get a question, and I'll start asking questions that were submitted to if folks like run out of questions to ask.
And if you have more questions, then you can just put your hand up. also.
Yeah, so how long before your test did you start studying? And what advice do you have on balancing studying with a job search? So this is a multiple. This person's nervous about doing classes, especially during finals, job searching, and top of studying for the test. I know it seemed like you kind of touched on that, Christina, a little bit, but maybe elaboration. Anyone?
What was the first part of that one?
Okay, yeah, how long before, your test did you start studying?
I can say I started studying in July and I took the test in August, but I also wasn't studying like every day of the week or anything. It was more like I dedicate a couple hours each week, probably.
I just started studying actually this month, for my test in January. And then you said the next portion
Yep.
was about,
And what advice do you have on balancing time, studying and job searching? Yeah, and doing classes if they're in their last semester.
I don't know if you want to speak to that one?
So I don't feel like I'm the best to speak on this because like, so I've had 6 semesters total and this has been my lightest load. So like, for me, the timing all worked out really well. I only had weekend classes this semester. I didn't have like 19 credits like I was taking in the spring when a lot of other people were taking their exams. But yeah, I'm kind of taking it one step at a time personally. Like I took the test in the middle of having classes and that was a little bit stressful. But now it's like that's taken care of and like vaguely doing job search stuff now since I still have a while before like I actually have my degrees.
So for me, when I was trying to study with, classes, I was like, you have classes, you have field placement. I was also working another job, while doing classes. So, studying was kind of hard to fit in there. So that was when I really just, I reassessed and I said, I can't do that. So that's where, in terms of balancing, it doesn't really help or answer that question. I think it was really just recognizing, do I have the time? Do I have the capacity to do this? And that was definitely something that I had to kind of reassess there. I would try to study like twice a week, but that's when I realized I couldn't really do that.
I think it, and just like what I've advised students is it can be very individualized, like, and I think you both touched on that too, like you kind of have to feel it out for yourself where you are in your stage of studying and applying for jobs. And I'm also so sorry, I skipped people's questions, so, but we have some hands up.
Can I add?
Yeah, go ahead.
Another thing that I found really helpful was an app that I don't like, the name of it's like awkward, but like I essentially did search pocket prep and you can do like
Yeah.
test questions on there. So it was like little things I could fit in more easily than like sitting down and
Yeah,
studying.
there was an app that was like, I think $40 or something, maybe.
Oh, I didn't pay that much for the one I had, but.
I didn't pay for it.
Oh,
I got every app and didn't pay for any of them and just rotated. So just if you want to do that.
Okay, but I saw we had 2 questions.
Yeah.
We're gonna start in the back first.
I was just wondering if maybe not the two of you, but if anyone in the room could like speak to this a little bit of like, I know your timelines like looked a little different, the types of like jobs, Christina, like you had maybe didn't like require licensure. So I'm just curious about like, if we could talk about in terms of timeline, like how that might affect like your job search and things like that, and like what we have to sort of consider when we're doing, like looking for more of a clinical position after graduation.
So, like I said, my timeline has been different, but I was on a clinical track, I guess still am since I'm still a student. But most of the people who graduated in May when, who I was taking classes with, they all wanted to make sure they had the exam done first to be able to say like in job interviews that they had like passed the exam, or even having it scheduled, they felt more like comfortable with in terms of job search. I also have some friends who did not take it until after they graduated and got like a position that maybe wasn't like what they would have ideally liked, but they went into like a case management role right after graduation and took the exam in September. So now they're able to like start looking for something else. So it's like, if you find that you're like, if you find yourself not in a position to feel like ready to take it before graduation, like there are other roles you can still go into even without having the exam or the licensure. But I found most people were trying to do the exam like earlier, like in the spring semester. So then they like had that like as leverage, I guess, for their job interviews.
And I would add, I don't know who asked the question, but last year I was like at the end of the school year, I was able to use my SWT for like a couple months after school was over. So I don't know if employers would care about that, but I was able to stay at my field.
I think it also depends on who you're gonna be talking to too, like with your employers. That's something to really keep in mind, which I've realized, like who you're applying to and what you can negotiate with them. That's a big one. So, because I know some people who did take the exam before they graduated and, like you said, yours isn't gonna be active until you actually get the degree. So that is something to keep in mind is you will just take it before and then you can have it secured. Or if you talk to the position, I know someone who was actually a year above me and she had a position solidified, but she had talked to them and they had said like, so long as you get your, licensure, then you have this job and they held it for you.
Yeah, like I know a lot of people who had like tentative like offers or it is really just like organization by organization, like it's really variable.
Which like sucks as an answer, honestly, like it's it really, it's awful. Yeah.
Was similar to just because you had mentioned you took the exam before graduation, but you're saying it's not active until you have your degree.
Yeah, so like after you take the exam, you also have to get like a finger or a background check, FBI and BCI background check. Watch, I think it's that rules and regulations video, you have to watch that before getting the license, and then the transcripts have to be submitted.
You
So,
don't instantly get your license after you graduate either, so it takes a little bit.
yeah,
Yeah, so you pass, like I passed mine in September, at the end of September, and then it was active in October. So there's like a couple weeks, they tell you how long.
yeah, like and even a couple weeks after I took the exam, I got an email from, I think it was the Ohio like licensing board, that said, we have the exam like that you passed, it's just you need to do these other steps, and so, yeah.
Real quick, can we review the steps? Someone had asked about the steps of getting your license and like what order, or it's kind of variable depending on if you apply before or after, but.
Yeah, so I'll say if you're applying while you're a student, it has to be in your last semester. Cause I wanted to take it over the summer and I was not able to do that, so I had to wait until the fall semester started. You have to get the letter of good standing from, the school, from the registrar. And that didn't take too long for me to get personally. I got it within like 2 to 4 days. I don't remember exactly how long. But then you do whatever state you're applying for your licensing, you do that application. And then once that application is approved, you like sign up or purchase the test through the ASWB. And then after that, like once they confirm whatever, and that usually takes a couple business days, you schedule your test through Pearson. Is that right? Okay. And then after like if you're doing it all while you're still a student, after that you have, until you want to like activate your license and have everything ready, you have to do the background check, watch the video, and submit the transcripts once you graduate.
The only thing I'll add to that is the letter of good standing. You will, depending on when you're asking for it, so like I asked for it during that first, my spring semester, my last semester, just know it may take a little bit longer because there's gonna be a higher demand for those letters of good standing. So just keep that in mind when you're sending that out.
Whereas I requested mine like September, so probably not as much demand right then.
Anna?
I have 2 questions. So one, so you have to apply for your license before you can schedule your exam.
Yes.
And then how often are the exams, like, when I look on the website, it doesn't say like how often they are or how, like, they're like, schedule it as soon as possible because they fill up, but do you know how often they are?
So like, are you asking about like available dates then for the exam? So it'll vary by location. When I was looking, like the Beechwood location, like had very few like remaining. I'll say like very few like that were like closer. And like some locations only do it on certain days of the week. But like I was looking at Beechwood and Independence personally, and like most days of the week were available morning or afternoon. And it's more just like, you just like probably won't be able to do it the week of. It'd probably be a couple weeks out from when you'd be scheduling it to when you could actually take it. But there are like almost every day of the week except Sunday is available to take it, depending on the location you're looking at. So like if,
All
Like-
year round? Like it's always available?
They don't, do they run in cycles? Like there's an August cycle or a February cycle, or
When-
it's just year round?
so I mean, when I was looking, like I was able to schedule anywhere from like, I scheduled it in like at the end of September, I scheduled it like 2 weeks out in October, and I could have scheduled it, like there were dates all throughout like October, November, December. She scheduled it
Yeah,
for January already.
literally, I'm like, yeah, it's pretty
I
far
think
out.
they have like, I'm sure that they have like times literally every month,
Yeah. they
and
do.
probably every week.
Maybe the holidays impact, but I would say
Yeah.
that's it, because I also rescheduled mine, so.
Yeah, holidays.
Rolling registration.
Yep.
It's
Yeah.
all throughout the year, lots of days and times. So it's just a matter of what's available for you, and there's plenty of locations. During COVID, it was very different. It was much more restricted, but now it's very open and available.
You may have to travel, I will say that.
Yeah.
Be cognizant that you may have to travel. I mean, I got pretty lucky each time that I rescheduled my exam. I don't know, maybe I just got the luck of the draw. But like, I was able to stay at the Beechwood or the Akron location, and I was able to reschedule each time.
And the four, like, closest to Cleveland, locations are Westlake, Independence, Beechwood, and Akron. Those are like the four that are closest.
Yeah, we did get any, and I think Dr. Hussey kind of touched on this, but any advice for folks like retaking it? And there was also a question in relation, Colleen had asked about, does it matter if they have their BSW right now? Is that the same exam? And I think this is specifically in Ohio too, that might vary state by state, but if they have their BSW, is that sort of like the same exam as their MSW? Like, is there a difference?
Yeah.
Okay, there is. And then any suggestions on studying for the second time?
I guess I would say again, look at your strengths and weaknesses, where you did well, where you didn't. Concentrate on those areas of domains where you did do as well. Think about the resources and materials that you use. Think about upgrading them, improving them, trying some different ones that may help you and may provide you a different perspective and have you do better. Think about also the possibility of studying with someone else. Sometimes, again, change things up a bit. You might find that studying with somebody else helps you, and it's one of the strategies that begins to improve your own study habits. The general guide is take a step back and be fairly process oriented. How do I study? How did I do it the first time? How am I going to change to improve it based on the information I have the second time? I'll just tell you a quick story. When many years ago, I was a certified chemical dependency counselor. When I took my test, there was a written test and then there was an oral presentation to a panel. Took the written test, I passed. I did the oral presentation. I failed. Why? I picked a case that was called a dual disorder case at the time for substance abuse. I was excited about it. This was great stuff. This is where the field's moving. I'm excited. I present the case. I failed miserably because dogmatically I deviated from the current thinking in the field that was very specific substance abuse. There was no such thing as a dual disorder or co-occurring issues. The mistake I made was I thought this was great. I thought this is exciting. This is where the field's moving. Everybody knows that. Big mistake. Second time I took the test, I was very clear and very focused on a very dogmatic interpretation of substance abuse training, competencies, and skills. So.
And I'll add to that, like, when I was studying and taking like practice questions, like, there were so many times when I was like, this isn't how I feel like real life would work. So like, prepare for some frustration with that. And like, there might be questions where you look at them and it's like, none of these answers seem like what I would actually do or what I should be doing. So like now trying to like take a step back and thinking about, okay, what would they want me to, like, how do they want it answered? And a lot of the times those two things align, like what you would do and what they want you to say. But there are times when it doesn't, and, just being aware of that too.
And I think it's important to keep in mind, this is one point in your professional career. So this is one test. It will not dictate how you practice and how you move forward professionally in terms of your scope of understanding and working with people in the community. But I do agree that it is important to think about how is that exam administered? What is the thought and rationale behind the questions? Because it may be different from how you would carry out some of your work in the community. And it's important to wrestle with that and be okay with that for the test.
Now, when the question asks you, what would you do first? They don't really mean, what would you do?
Right.
No, they want you to, if
Yeah.
there's an answer saying acknowledge, validate, like, consult with the person, like, it's always, the engaging piece is almost always first, and if you don't see that, then like assessment's next. Like, almost always with the first questions. And safety, I found that also to be true with what Dr. Hussey was saying, like, safety is just about always paramount, or autonomy, like, I had multiple questions about just like elderly, clients who might be in hospital settings and considering discharge, and it's like they want one thing, but the doctor wants a different thing, but their family wants a different thing, like, you prioritize the client, so just stuff like that.
It may sound very basic, but think about Maslow's hierarchy of needs. That safety, security, and then going up, but always go back to that. That will help you.
I know you talked about how expensive the process is. This isn't necessarily for you guys to agree. Does Mandel, or do you guys know of any like scholarships or financial resources? Because I know the test is what, like $230 or something like that.
And the application fee is 80.
Yeah, so that's $310 out of my pocket.
Yeah.
So are there like financial resources available?
I can't speak to anything through the school, so I'll let them do that, but I know, some people who started working after and took the exam when they were working, they were able to like have their job and their employer, contribute to it. So, or just pay for it entirely, so that could be an option, again, depending on like what the timeline for everyone looks like, but, yeah, I don't know anything beyond that, so I'll let other people speak to it.
Yeah, the Mandel School currently offers the LEAP exam as the benefit for students. So we pay for all of that, which is typically about a $250 value if you were to go out in the community and pay out of pocket. But we don't currently have any type of financial support for the actual licensure exam itself. Just so you're aware and know how to plan accordingly, which is, I think.
Wait, can I
Yeah.
actually, can I ask a question?
Yeah, go ahead.
Great. Isn't there the PD funds, the professional development funds? Would that be a possible way to?
Through the
Why?
GSC.
Yeah, there's a graduate student council for the university, but my understanding is that they don't currently have funds available for that this
Okay.
year, because we had reached out to them about a couple
Okay.
situations we had arise. So I think it is best, like you were saying, in terms of planning and thinking about this and budgeting cost. That is something to think about when you're figuring out when to take the exam and what will be best. But if we do find out of any funding or scholarship availability, we'll be sure to share that with students as we go forward.
Look at, possibly the Cleveland Foundation. Maybe look at United Way. There might be some local nonprofits that may be able to help, but I'm not sure, so don't quote me. But yeah, I just say, unfortunately, like, I had to, like I said, I worked during grad school, so like, I did use that money to pay for the exam.
You mind if we just sort of switch gears and talk about like out of state? I know that it's come up, and just reciprocity as far as like state to state. And then, let me just look at the question, sorry. Should you get your test, or should you take your test to get a license in Ohio and then transfer out of state, or vice versa? Should you just wait to move to the state and then take the test? And I can jump in too, and I think if you want to talk through with Mandel Student Services, I think again, it's very individualized, but I'll let people answer as they see fit. Maybe Dr. Hussey has recommendations, not to put you on the spot.
No, I guess I agree, Joy. I do your homework and find out what the implications are. You might not want to pay the money,
Yeah.
If it's not reciprocated in another state, we might defer and decide to wait. So not knowing how,
There is, there is cost to renewal, so if you're gonna like, transfer your license, a lot of states have a cost. It depends on the state. It's very, unfortunately, there's not an overarching, even though the test is the same, there's not an overarching licensing, like, where you can just transfer your license really easy. Hopefully someday that will happen, but we're not at that day yet. So it will really just depend, and I think it also comes into play of like, when you're graduating, when you're taking the test, when you prefer to take the test. Do you want to wait till after graduation when you have a job? Do you want to figure out where you're gonna go first? Maybe you already know. Again, I think talking through some of this with your student support specialist, student advancement specialist, we're happy to do that because it can just be very individualized. And then it's usually a 2-year license generally. So I know that question came up. And then once you get your initial license, and maybe Dr. Hussey and Dean McFarland can talk about this with the eye or a clinical license, it's usually there's supervision attached within that. It can be done within that first 2 years. It can be challenging. That's also something you should consider when you're applying to a job. So just like, we can talk about that too a little bit more, because I think that's coming through in the chat and maybe some of you are wondering about that. So feel free to jump in.
I think that's a great question, because when I did my LISW, it was still, you take the test first and then you take the supervision time. Now you get the supervision hours, which are a few thousand hours under supervision of a licensed independent social worker with that supervision designation, and then you take the test. So I think that's something to be really transparent about with students, so that you can take that LSW and get that done first, and then be working toward the LISW, depending on your professional goals and development plan.
So are you saying there's another test? It's hours plus another test on top of your LSW?
Yes,
Okay.
yes,
The
exactly.
clinical one.
They're 2 separate tests.
Okay.
LSW and then LISW, for
Right.
Ohio specifically.
Yeah, or LCSW. And again, it can depend on the state, so happy to talk through that more. It can be very specific. I know there was a question that came through about Texas. So if you wanna, I know we're like coming short on time, so if you wanna reach out to Mandel Student Services at case.edu, do our shameless plug right now, and we can talk through that, but all of it's available on our website too. We have each board listed and things like that. Okay, we have a question back there.
Yeah. There's like some pushing to like get licenses to just like transfer across states. Do we know like if that's likely to happen like in the next couple of years, or is it like decades or something? And also, wasn't it in the past at some point like that, where you just took a test and you were licensed for a state?
no, I don't think it was.
Unfortunately.
I think part of what's driving it, just by the way, too, is things like telehealth.
Yes.
It's like you don't have to be physically present in a location to provide therapy anymore. And whether it's clients in your state, 200 miles away, or across the country, 2,000 miles away, it's really very similar, and very much the same. But I don't know, it's hard to speculate. There's a lot of other issues about what will prompt that. Also, do remember, it's not just social work. When we ask those kinds of questions, think about even Ohio. It's social work, counselor, marriage and family therapist. Multiple disciplines, multiple professions that are all wrestling with and dealing with the same issues.
Yeah, to also go and speak a little bit on that real quickly. If anybody's looking to move, like I was looking to move originally to Chicago and I wanted to go to Illinois, they do not require you to have the license. But depending on the type of social work you want to do, for example, if you want to go into school social work, you do have to get their certification, go through their whole exam process, especially if you're going to work through the public school system. It is honestly a very rigorous process to go through. There's a lot of interviews and the exam that you have to pass. So that certification process looks a lot different depending upon what it is you want to do. So you may not have to have that overarching license, but there are going to be other exams and interview processes that you may have to go through.
guess broadly speaking, are there specific jobs in social work that across the board, no matter who the employer is, that you need the license for?
Any kind of clinical role, like other than like case management, so like if you're like a psychotherapist, most like jobs that I've been looking at have that requirement. Some of them even have like an one LISWs. So it's pretty, like, for direct practice clinical roles, it's pretty standard, it seems.
I think Christina talked about it earlier, like you get a pay boost. So if you, even in case management, if you don't have your license, but then get your license, you usually get a pay.
Yeah.
But it's tied to billing.
Yes.
Yeah, that too.
If your agency is gonna charge $90 for an hour of your services, that payer, insurance company, Medicaid, Medicare is gonna wanna know that the $90 they're paying is provided by a licensed professional.
In some nonprofit settings, you don't need to be licensed depending on the state. Like I've known people who've been in like clinical roles, not in Ohio, I will say that. But like that might be the one time you're not seeing it, but if there's billing involved, you'll see it pretty much.
I think we have one more question in the back.
Back to like the length of time spent studying for the exam. If, assuming most of us, like if we just signed up for it, like we plan to take it in a week. How, like, what's the shortest amount of time slash like cramming versus like 2 hours a week?
Be careful with that one.
I was gonna say, do you want my professional answer or do you want my honest answer?
I've got access to like the modules and stuff, and I'm wondering, like, I don't retain like facts like super well, so like I usually crammed, unfortunately.
No, hey, no shame on that.
No.
Literally no shame whatsoever. I also.
Like I identify very
Like,
much.
a month cram, or is it like 3 months?
You can, so I'm only speaking for myself. I think like a 1 month cram is doable. Like Leap would say like 2 is the minimum.
Leap says 2 to 3.
Yeah, they say 3 for more time, 2 for cramming. Again, I think it depends on what you know you need to do. All the studying I did, I could have fit into a couple of weeks, if I'm being completely honest. I'm not an example I think anyone should live by in terms of that kind of thing, though. So yeah, I'll just leave it there.
And like I've kind of stated before, like I'm currently trying to start studying now. And I'm not taking it till late January, but it's more like I'm taking into account the life circumstances that are currently going on. And so I know I'm not gonna be able to dedicate a lot of time. I think like I would just take a practice exam, see where, again, identify those areas, and then depending on how you, again, study and retain information best, if you are someone who performs better under pressure and needs that to like, get you moving in a gear, then by all means, go ahead and do that if that's what you think is, gonna be the best for you. But just making sure that you have an understanding of which areas you need to study for, then that'll help you be better prepared for that cramming, time.
And we have access until of the modules until. Yeah. Like a week.
So.
Yeah,
No,
it's 6 full months is now, yeah, it's
Oh,
it's
that's
now
great.
6 months.
I had 3 and I
Yeah.
didn't look at any of the modules from when I like signed up for it. So I'm glad that they've extended that. That helps a lot.
One last question.
Yeah. Mine are quick. You said it's all multiple choice.
Yeah.
Yeah. Is it electronically you're taking this or paper?
Electronic.
And then lastly, I knew someone who was a social worker in the DC area, and I believe they were licensed in both Virginia and Maryland. Can you be licensed in more than one state?
Yeah.
Is it just really expensive and hard? I don't, like, because you're living by 2 different standards, or is that?
I think it would really depend on the state and like,
Okay.
yeah, you'd probably have to like pay for the license in the digital state. But I don't like, I know people who just do it to do it. Like, I've had some people who've done that, and I don't understand the rhyme or reason for them being licensed in Ohio and Georgia, but they are.
Yeah,
And,
I was just thinking like let's say you
Yeah.
live in Cincinnati and you wanna serve people in Kentucky, you know, like I was
Yeah.
thinking
I think
areas
it's very
like that.
doable.
Okay,
But I think it would just maybe again depend on the
Yeah.
states too.
okay, thank you.
Alrighty, thanks again to our
Thanks, everyone.
panelists and speaker. And if you have any questions, feel free to email Mandel Student Services if your questions didn't get answered today. And then I can turn it over to Kim to close it out.
All right, well, thank you, everybody. We know we're at time. We want to be respectful of everybody. Thank you again to our panelists for being with us. And we appreciate you sharing all your personal experiences. This is very valuable. And know that we will follow up with everybody who registered for the course today for the session with some extra resources, and we'll have the recording ready to share shortly. So just keep an eye out for that. And thanks again for taking the time to pour into your own professional and personal development. We appreciate everybody being here.
If you want to talk further, like, and your question didn't get answered, you can just reach out to Mandel students.
I also don't care if anyone reaches out to me.
Yeah. So that's so fine.
And if you two are gonna be around for a couple
Yeah, I
minutes
can
after,
also-
okay, if you have questions, feel free to come down.
Yes.
Thank you, everybody online as well. Appreciate your time. Take care. Yeah, like.
Yeah, usually.
You know, that's